Wisconsin will not be getting $45 million in federal money it was counting on to fund health care for the elderly and poor.
And that has some of the most vulnerable in the state and right here in our community worried about whether their access to health care will be affected. News 8's Jenna Traum joins us now with more on how the timing of this news is leaving the state scrambling to find a new source of funding.
It's funding Governor Scott Walker planned to use to help close a major budget gap. This money his administration was expecting from the federal government would have made up nearly a fifth of that shortfall. The state of Wisconsin was caught off guard. Governor Walker's administration thought $45 million in federal money was coming their way, but it's not. This comes at a time when the state is trying to find about $220 million to fill a budget shortfall in health programs for the poor and the elderly.
It's a substantial chunk of it. It's about 1/5 of the money they were depending on to fill this hole. So that's very concerning.
Wisconsin and several other states were paying disability benefits the federal government was responsible for. Those states want to be reimbursed. But now the U.S. Department of Health and Human Services says sending the reimbursements they were expecting is outside their legal authority.
I think there was a sense that this funding would be coming our way. The government has been working on this project for some years to try to fix this error. This is nothing that they were unaware of. We were aware of it.
And the director of La Crosse County Human Services is worried about what that might mean on the local level.
1 in 6 individuals in the county that are dependent on some form of income assistance or access to government health benefits. There's about 12,000 individuals here in La Crosse County that are on Badger Care, the Badger Care health benefit. So in terms of sheer numbers, there is a large potential impact here in the community.
And the biggest concern at La Crosse County Human Services is whether access to health benefits will be limited to make up for the cash.
I'm hoping they can find a way to come up with a savings that isn't going to restrict the coverage for people that are receiving Badger Care Plus.
So what's going to happen? Both in the capital and here in La Crosse, the answer is the same.
We don't know yet. We'll be anxiously awaiting in terms of how the state and the Department of Health Services intends to plug this new hole.
A DHS spokesperson tells me right now there is no plan for how to make up the $45 million and no timeline for when we can expect to see one. She says they're hoping to keep health programs open to as many people as possible.
All right, thank you, Jenna. The Walker administration is already facing criticism for a proposal that would shift many Wisconsinites to lower-cost health plans.